problem hearing her this time. As long as she sits right there.
The oral palate's main function is to assist in speech, destroy bacteria and viruses, separate the oral and nasal cavity, secrete saliva.
Is it C?
I think it separates, yeah.
Separate the oral and nasal cavity. Saliva contains an enzyme called amylase, trypsin, chyme, pepsin.
Wait, what was
Time.
it?
No.
Saliva contains an enzyme called amylase,
Oh,
trypsin, chyme, or pepsin.
Amylase.
Amylase. The epiglottis helps propel food to the esophagus, secretes digestive enzymes, contains the vocal cords, covers the airway.
That was either way.
There's the airway.
It's so hard for me to pay attention.
The esophageal hiatus is the end of the esophagus, the part of the esophagus that connects to the stomach, the part of the esophagus that passes through the diaphragm.
Passes through the diaphragm.
No, it's, oh, is it? I thought
Yep.
it was the one that connected to the stomach.
Nope, the esophageal hiatus is the part of the esophagus that passes through the
It's not a
diaphragm.
workbook, right?
The stomach is able to absorb sugars, proteins, nothing, alcohol.
Proteins. It's
Alcohol.
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 It passes
The
down.
gallbladder is essential to digestion, releases bile in response to the hormone cholecystokinin, increases the absorption of fatty acids and cholesterol, is located inside the liver,
Bile.
releases bile. You will instruct your patients who are at risk for cirrhosis of the liver that they can reduce the risk by avoiding the use of alcohol, washing their hands, avoiding weight loss, over-the-counter drugs.
Alcohol.
A patient complains of constipation, you will recommend stopping all medications, increasing dietary fiber.
Yes.
Yes.
A patient reports several episodes of diarrhea. What would you review with her to try to prevent diarrhea in the future? Her activity level, her fluid intake patterns, her food handling practices.
Food handling practices.
Absolutely. A patient tells you about what seems like a large dose of acetaminophen. You will respond by asking if it relieves his symptoms, explaining that too much acetaminophen could damage his liver, telling him that it is a very safe drug and may be used liberally, telling him he should not take acetaminophen.
That would damage liver.
B, explaining that too much acetaminophen could damage his liver. Tobacco use is a risk factor for,
Cancer.
Lung cancer.
remember your chapter.
Or it's gastric.
Mouth cancer.
Oral cancer, very good. Which layer of the wall of the alimentary canal contracts to move materials through the canal? The mucosa, the submucosa, the muscular layer?
Muscular layer.
Yes.
Wait, what was the question?
Which layer of the wall of the alimentary canal connects to move materials through the canal? It's the muscular layer. The blank is the innermost layer of the alimentary canal wall and absorbs nutrients.
Mucosa.
Which of the following layers of the alimentary canal wall has blood vessels that carry nutrients away? Submucosa. Very good. The blank layer of the alimentary canal wall secretes mucus and enzymes.
It's, I just read.
Mucosa, submucosa, muscular, serosa.
Muscular.
The cirrhosis.
Mucosa.
Mucosa.
The mucosa layer of the alimentary canal wall secretes mucus and enzymes.
Yes.
Which organ of the digestive system begins the chemical breakdown of food?
Esophagus.
I was thinking it's the mouth.
The mouth. Very good. Digestion begins in the mouth. Which organ of the digestive system connects the mouth with the esophagus?
Wait, what?
Which organ of the digestive system connects the mouth and the esophagus?
Yeah.
Pharynx, yes. The digestive organ that absorbs water and electrolytes is the stomach, the small intestine, the large intestine, the rectum.
Small intestine.
Large intestine.
You want me to get this?
The blank is the main site of nutrient absorption. The stomach, the small intestine, large intestine, rectum. Small intestine. Which organ of digestion regulates fecal elimination? The stomach, small intestine, large intestine, rectum. Rectum.
The bud.
Which of the following uses peristalsis to push food through the stomach? The mouth, the pharynx, the esophagus, the larynx. Yes. In which of these is food mixed with bile and pancreatic enzymes? The stomach, the small intestine, large intestine, or rectum?
Is it the stomach?
Repeat
It's
it.
mixed with bile.
In which of these is food mixed with bile
Small intestine.
and pancreatic enzymes? Small intestine. Which of the following organs of the digestive system secretes acid and enzymes? The stomach, small intestine, large intestine, rectum.
Stomach.
Stomach. Which cells of the stomach secrete hydrochloric acid and the intrinsic factor? Acinar cells, mucus, chief, parietal.
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 Oh.
The cells of the stomach that secrete hydrochloric acid and intrinsic factor are parietal cells. The cells that protect the lining of the stomach are mucus, chief, parietal, acinar.
Mucus.
Yes. Which statement best describes the duodenum? It is directly attached to the large intestine. It forms the majority of the small intestine. It is C-shaped, short, and at the beginning of the small intestine. It is the middle portion of the small intestine.
It's C-shaped.
Beginning,
C.
yeah.
Which of these enzymes digest proteins in the small intestine? Intestinal lipase, sucrase, maltase, and lactase, nuclease, peptidase.
B, it was
The peptidase. Okay. Just so you know, whenever you see sucrase, maltase, and lactase, those ASEs, they're sugars.
Okay.
Which of these enzymes digest sugars in the small intestine? Intestinal lipase, sucrase, maltase, and lactase?
That one.
Yep, because they're sugars. Which of the following vitamins is not fat soluble? A, B6, D, K.
K. Isn't it?
D.
D.
Not fat soluble.
Okay.
There's B6.
B6. Which of these vitamins is a fat soluble vitamin? C, E, B6, B12. E is fat soluble. Which of these vitamins is not water soluble? C, E, B6, B12.
B12, isn't it? What was it about the B12 shot that you just learned about?
It's something in the myelin.
Vitamin E is not water soluble. Which of these vitamins is water soluble? A, B6, D, and K.
Would it be K?
B6.
B6.
B6 is water soluble. Which vitamin is needed for blood to clot?
Okay.
Which vitamin is needed for production of visual receptors?
A.
Very good. The vitamin needed for production of collagen and absorption of iron is?
C.
Very good. The vitamin needed for absorption of calcium is?
C. No, D. Right?
D. Calcium and D always go together. When you get my age, you take calcium with D.
I'll take some.
In blank, also called heartburn, stomach acids are pushed into the esophagus.
True. Oh.
GERD.
True.
Oh.
I thought it was true or false.
So, like, I have a question. What vitamin is it that they say that takes away when you smoke? Is it vitamin C or D? They say, like, if you're a smoker, you should eat oranges to, like, balance it out. Something
That would
about
be vitamin C.
vitamin C for your teeth. Okay.
Okay. In which of these conditions does the stomach lining become inflamed? Crohn's, diverticulitis,
That one.
GERD, gastritis.
Diverticulitis.
Gastritis.
They had the itis, is what called me.
Blank is a chronic liver disease in which normal tissue is replaced with scar tissue.
Oh, no, yes.
Which of the following causes the stomach to rise up through the diaphragm? Crohn's, diverticulitis, a hiatal hernia? Very good. Which of these is an autoimmune disease? Crohn's, diverticulitis, gastritis, hepatitis?
Hepatitis. No, it's the one
Diverticulitis.
I had before.
Crohn's.
Crohn's.
Really, no one gets it. I said
Crohn's disease is an autoimmune disease. Blank is the inflammation of abnormal dilations of the intestinal wall. Crohn's, diverticulitis,
Diverticulitis.
yes.
It's gonna be hard though.
Inflammation of the liver is called
Hepatitis.
hepatitis. Which of these results from the breakdown of the lining of the stomach? Crohn's, gastritis, hiatal hernia, stomach ulcer.
Stomach ulcer.
The condition in which distended veins become irritated is hemorrhoids, diverticulitis, gastritis, hiatal hernia.
Hemorrhoids.
Okay,
You can't have that.
God is my bad, Sue.
then we go into the picture.
I probably would have to wait up for that everything. Let me say this.
That's the one they're labeling?
Mhm.
Just flash that across the camera.
Oh, wait, let me zoom in on that. Yes, second.
Well, it's your bullshit right here.
It's just the major organs, right?
Yes, it
Yes.
is. It sure is. There you go.
No.
We might as well just study for all of them together.
Yes, ma'am.
Oh, never mind. I thought you were done.
Inflammation, something with an itis.
The inflammation of the appendix is called,
Appendicitis.
the molars or blank are flat teeth in the back of the mouth designed to
Incisors.
grind food.
No, the incisors are
Bicuspid.
Cuspids.
Bicuspids. The bicuspids and the molars are flat teeth in the back of the mouth designed to grind food. The mass created in the mouth by food mixed with saliva and mucus is called a
Give us the option.
Bolus.
It's a right the answer.
So what is the
Whoa,
question
those are
again?
fill in the blank?
Yep,
Hang on, guys.
the last few have been. The mass created in the mouth by food mixed with saliva and mucus is called a
Bolus.
bolus.
Yes.
Nastiness.
All right.
Miss Sue, question. Can you break up the test for us? Like, how many multiple choice do we have, labeling, and fill in the blank? Are there any true false?
Right here.
No.
The mass
I
created
just
in
needed
the mouth.
that first page.
Ow.
Okay, are we done?
That's what we give Rose.
Miss Sue?
Just a second, please. I'm trying to help Alexa.
Cranberry.
Okay, so it looks like there's 42 multiple choice.
Okay.
No, wait, I lied. There's 45 multiple choice.
Okay.
And labeling is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10,
It should be 12, right?
11, 12. 12.
12.
And write-ins are 1, 2, 3.
Or you fixing to write a study on it?
Thank you, Sue.
Uh-huh.
That's my last one.